Okay, we are here with a poster from Sylvia Burns, and she's a massage therapist in Seattle, Washington. And Sylvia, you've got one of our case report posters here. This is that correct?
Yes.
One case study?
One case.
And this is a case of somebody with post-concussion symptoms that went in for massage therapy. And this is an area of interest for you as a body worker.
Right.
What prompted you to engage in this treatment series, and why did you think this was worth talking about and worth bringing forth to the profession?
All right. So I see a lot of patients that have sports injuries. Right now, concussions are being emphasized in sports medicine, and so from the sports aspect, I'm getting clients and patients that are suffering from symptoms, and I thought there has to be resolution with the knowledge that we have in the field. So then I began to think that also this applies to any type of trauma that occurs with the cervical and cranial area. So it has application not just in concussions and resolving the symptoms, but it could go even beyond that. So I thought we need to have the information where people can start using it and applying it to their patients that have these traumatic events.
And it's probably the case that for the vast majority of folks in this country and the world who are suffering from traumatic brain injury, whiplash trauma, any damage to the central nervous system, most of these folks are probably completely unaware that massage therapy could be an option. And most of their primary care physicians, most of their clinicians are probably unaware that massage therapy has any potential to help. And even if they think it might, they probably don't have any sense of how a therapist would go about doing that, right?
I would confirm that.
So how did you go about doing it? What did you do to help this guy out?
So he was examined, evaluated, diagnosed with a mild, medium concussion. Although they don't grade concussions anymore, you either have one or you don't. And the next morning he woke up with dizziness, extreme nausea, fuzziness, not really able to think things clearly. So he had medications for pain, for the nausea, and he had been on that for 2 or 3 weeks, and it was not improving greatly. So the primary care physician decided to send him to massage therapy to see what we could do. So when he came, one of the things that he said he was unable to do was to ride in a boat or in a car. He got car sick, he got boat sick. He wasn't able to do any of his graduate assistant work on a computer. Mm-hmm. And that's very typical of neurocognitive post-concussion symptoms. So, that wasn't something that I was really concerned with, because that will heal over a period of time. But the other symptoms of dizziness, fuzziness, headache, I was certain that I could do something to help him with that.
And these symptoms are, if I'm not mistaken, are sometimes things that can persist for a long time.
Right.
Post-brain injury.
Exactly.
So, what did you do? What did you do in your massage practice?
Well, my practice is based on biomechanics and a lot of kinesiology. So what I was able to do was to go back through the event and look at it biomechanically. Any action that creates enough trauma to create a concussion is going to cause imbalance within the musculoskeletal system. So I evaluated the pelvic girdle and then went to the cervical area. And it's always a case where it seems like the cranium and the cervical area are in an imbalanced situation. And so that's what I was evaluating to start off with.
So you're assessing the position of these things, and you're applying body work to try and create a better position, more balanced position.
Yes.
Myofascial strokes, Swedish, craniosacral. Was it a mix of all of these things? Okay.
Yeah, it's a mix of a lot of neuromuscular technique. I have a philosophy that there's two reasons that muscles are contracting and holding tight. One is that if you get injured, it does a natural casting, so of course things would be tight at that point. The other is that if you're off balance or you're asymmetrical in your body, then the muscles will try to bring that back into balance. So you have to find where that imbalance is. So through the neuromuscular work, I would use suboccipital work so that I can soften and palpate the area. Usually what I find is that there's a restriction in range of motion, so I add that to the evaluation. There's some joint mobilizations that are available in that area, some manual therapy. This is case by case. Each case is just a little different because the biomechanics are often different. So once I determine what the puzzle is, then I'm able to do some restorative techniques for that particular condition.
So for you, it's more about an overall approach. It's more about kind of getting a sense of who you're working with, what you're working with, and then deploying all of the techniques that you accumulated to try and help.
Exactly.
So you did some massage. How many massages did you do?
Well, we did a total of 6, but the biggest improvement was after the first session and after the second session.
So that's my question. What was the improvement?
Yeah, the first session, he had no dizziness or nausea following treatment. He was able to, what I did, I used this BESS, which is Balance Error Scoring System, and it's a quantitative evaluation. You're supposed to have your eyes closed, hands on hips, and then you stand on a firm surface with both feet and one foot, and then with your feet one in front of the other.
This looks like a roadside sobriety test.
Yes, it does. But and sometimes he couldn't do any of these, even on the firm ground, and when on the foam, which was even more uneven, he couldn't do it at all, even with his eyes closed.
And did he regain some capacity?
Yes. When we tested post-test after the second session, he was able to complete these on the firm ground with score 33 would mean that you made 33 errors in the whole test, and he was able to drop from 33. He was able to go back to about 22 it was. And so that was a good improvement. Yeah, he still couldn't do the foam, and so that he could, with his eyes open, he could do it, but he couldn't do it with his eyes closed. But an improvement from 33 down into the 20s is quite good.
So this would be a clue. This kind of study would be a clue to the research world, to the integrative healthcare world, to the population of folks suffering from brain injury, that that massage therapy could indeed be really helpful. But let me just ask you one more question, devil's advocate. Let me be a skeptical healthcare practitioner and say all these changes were independent of the massage therapy. He had his recovery at a timetable that is sometimes consistent with folks suffering from concussion, and really what he got was a couple of nice massages, and you're attributing your results to those massages unfairly. What would you say to that? Or yeah.
Well, the reply is that he improved his best score, which after one session was remarkable. 2, he was able to ride in the car, ride in the boat without any nausea, self-reported, but still a real thing in his life. And third of all, he was actually able to go back to a short computer use during the day, which meant that it was some cognitive movement that he was able to do on his own.
This was after one massage, two massages?
After 1 hour he could do it. And then after 2, we did some fine tuning that he was even more advanced in his progress. These, in my experience, to get to that point with just letting things go in a natural way would probably take 10 or 12 weeks. And
well, here's one case of something pretty remarkable.
It is.
Well, thank you, Sylvia, and this is exactly what we're hoping we get from these poster sessions, is the kinds of remarkable results that we all as massage therapists get in our practice, but we just don't tell people about them.
That's right.
And you've gone and told people about it, and I'm really, really happy that you did. So thank you, and thanks for being with us today.
Yes, thank you, Michael.